Hey everyone, I'm your West Coast Buckeye here, Deidra Kathleen. Welcome to Suite 419. Our guest today is Katelyn Weaver from Canada. Part of Canada you coming from, Katelyn?
Ontario.
Ooh.
So right in the middle.
Oh, snap. Okay. What can you tell me about Canada?
10 provinces and 3 territories. The territories are all up north, and then the provinces range from huge to, and okay, huge being, let's just say the size of a state. The middle. I think we're probably the most populous province in the country, but
Okay.
don't quote me on that.
Do you consider your province to be French Canadian?
Some parts are more French Canadian than others, but like on the whole, it's more of an English speaking uh, society or whatever you'd say. In parts like Ottawa, which is the country's capital, there are a lot of people who do speak French, and we do have French classes in school and something called French immersion, which is basically 50% French and 50% English. Um, and French only schools as well. So we have a little bit more
Oh,
diversity in terms of like French speaking stuff, but on the whole, we're mostly English
that's
speaking.
amazing. I have a question in regards to those schools. Are they considered public or do you have to pay fees in order to go to them?
So French immersion schools or schools with French immersion in them are considered part of public education.
Mhm.
Same with Catholic schools. So we also have public and Catholic schools, and they're considered part of technically public education. So it's government funded. And then I think there are some private full French schools, um, but there might even be some that are covered by the government. Um, Again, that's not something I'm totally sure about. There are private schools throughout the country. Um, and, things like Montessori programs are private. It's a daycare. My brain just thought about that. And a lot of the daycares and stuff are private. But I think for the most part, French, like French speaking school, is uh, considered part of the public education system. So I would say, as a whole, um, the majority of Ontario is English speaking. But there are certain pockets where there's a strong French Canadian influence. So in places like Ottawa, which is where the government spends a lot of its time, uh, there's significantly more bilingualism.
What do you think stands out most about your province compared to others?
We have a lot of beautiful forested areas and a lot of really nice wildlife. We have Niagara Falls, or technically the Horseshoe Falls, uh, which is just stunning. Um, it's a very big province, so we have everything from like really populous cities to like farm towns to literally have to travel by a small plane to get there in certain months of the year kind of towns. So we have a lot of diversity, which I love. I'm lucky, when I get out to Toronto, there's a lot of stuff to do. But I don't live in the crazy of Toronto all the time.
Mhm.
So that's nice. However, I'm a little jealous of BC because BC has ocean and mountains. And I'm a little jealous of the Atlantic provinces because, um, like, you see pictures of those rocky shores and it's incredible. Honestly, I love, mm, I say I love a lot of Canada. I haven't actually traveled as much as I would like to, though. So,
So where you particularly live, I'm not going to ask for overly specific things, obviously for your safety, but um, how would you describe your area? Like, are you in particular in a suburby area, a more country area, like a more of city area? I know things can change real quickly
oh,
wherever
yeah.
wherever you might live. Like where I'm from. Like Toledo is more of like a city kind of place, and then like, 20 minutes out, you're starting to get more country. So I'm curious what it's like more so for you.
I would say I'm on the outskirts of a city, but like within like 5 or 10 minutes of it.
Mhm.
Um, so, and we're talking like mm, about 500,000 population, so not like insanely huge,
Mhm.
but also not tiny. Um, and I kind of like it here because it's a little bit far off from the big drama of the big cities, but there's still stuff to do, which is nice.
So I know that in Canada, like that of the United States, you also have tribal areas. I was wondering if you are like, are there many like specified tribal areas around where you live, areas like reservations, like in your province?
Yeah, so there are reservations. I mean, some people live off the reservation. But yeah, honestly, I don't know quite enough about it to say too much. But
Mhm.
yes, there are reservations for Indigenous people. We try to respect the fact that we're on indigenous land.
Mhm.
So a lot of the time in big events or shows or schools, they have what's called a land acknowledgement, where we recognize that um, it wasn't our land first, and we need to respect that. So, but
Okay.
yeah, I haven't had much experience going to a reservation. Um, but I also know there's varying, um, like there's definitely some issues that go on there in terms of inadequate schooling, especially up north, and inadequate housing sometimes. So,
Yeah, no, I've thought of a bunch of different questions now. But um I do know for a fact that the indigenous tribes in Alaska, right by y'all, they are actually the most affected by depression out of all of the indigenous tribes in the United States. So the tribes in Alaska, they are not connected to as many resources. I mean, I don't imagine them being the only tribe affected, but I know from one specific TikToker, I will not name because I don't know if he would be okay with it. Um, I know that he made a video of they had to have someone drive all the way from like a way far away place to deliver groceries.
oh wow.
Like, yes, he's lucky enough to see the aurora borealis all the time, but then like you're on your own, you're in the darkness a bunch, and you're way far away from where you should be able to, you know, take care of yourself better. So, matter of fact, Canada implemented universal healthcare in 1966. And this is according to the New York Health Department's governmental website. It's listed in the regulations, which goes from the early 1900s until the 1990s. Now, here in the US, we still have not done that. Okay. My question is kind of more in regards to what your experience has been like being in a country that has universal health care.
So there's the old joke that a woman will go in and have a baby, and all she had to pay for was parking and the cost of Tim Hortons, which is a fast food chain here. Um, and yeah, I mean, I had two major surgeries last year, and it cost me nothing. Um, it cost my family a bit to park. Um, there are some things that cost. So, for example, if I wanted um, a two-person room or a private room. Um, I think a two-person room uh, would have run me an extra $50 a night if I hadn't had insurance. And then a private room, unless you're like contagious or anything or
Yeah.
something, um, I think would have been like $100 a night, but it might have been more than that. Um, but yeah, I wonder what I would do if I didn't have the universal healthcare. I'm at a point now where I'm an adult and, I have a full-time job and I can pay for some things,
Mhm.
but if I had to pay for everything, my savings would be gone.
I go back to personal rooms and
Yeah.
their privatized rooms. Are your rooms differentiated by actual tangible walls, curtains? Like how is it actually like formatted?
Yeah, okay. So, I mean, obviously I only know the hospitals that I've been in,
Mhm.
but a ward would be four beds separated by curtains. So everyone has their own space with a like a closet area, um, a TV if you pay for it, um, and a counter and one of those hospital tables that you can bring over, and one or two chairs. A two-person room is also separated by a curtain. And if you're getting a private room, you have the entire space. And usually they're a bit smaller than a ward or a two-person room. I ended up in a ward because there were no two-person rooms available or private rooms available. And it's definitely different, especially when you're trying to recover.
Mhm.
There's not enough sleep going on. But I mean, it's not that bad. There are people coming in and out all the time. But I kind of feel like that's like when I think of a hospital anywhere, I think more of those like ward situations. So it's like two on one side and two on the other side.
Mhm. Okay. So like I understand like I have a lot of empathy for the like not having your own room situation.
Oh yeah.
This last time around, like I actually got the blessing of having my own room both in like both areas, like before you actually get your official room.
Oh,
I don't know if you do that in Canada as well, but they uh here in the United States hospitals, there is like the waiting on an official room situation, and a lot of those rooms have curtains. And then there are the like long-term stay official rooms. Those actually have doors, usually like some kind of slidey ones, at least from my experience. My last time having surgery, which I've only ever had two surgeries, but it's been these past 2 years. But my last surgery was this year, this past February, and the one prior to that was basically around about the same time, just last year, 2024. But with that experience, because whatever area I was in the kind of like it was the complete opposite, basically, of what I went through this last time. This last time I got the only room that had a door. Okay.
oh,
And I had put it like I had let them know what had happened with for the previous surgery. The 2024, the first surgery I ever had, I had only ever gotten the room with curtains. Every other room had doors. Okay.
okay.
So I barely got any sleep. I had nurses coming in genuinely every 2 hours to check up on me. And then I could hear my neighbors being loud when, like, because they had a bunch of family like visiting in one room. And then actual employees were speaking quite loudly. And I'm not being hyperbolic, I'm not exaggerating. So I get the whole like curtains situation, and it's so strange. I never like actually thought about it, about I had the complete opposite experience this time. this
Oh,
past time in 2025. Yeah, I remember mentioning though, like, please make sure we have a door this time. I did not sleep
yeah.
last time around. So I understand that, but do you have any kind of like situation in regards to that where like do you have a temporary sleeping place before you're given an official room situation?
I think that mainly happens in the emergency room. So if someone is going to be admitted, they're likely to be given like a specific area. But when I think about the fact, like the no doors thing, I imagine like in the general ER, there's there tends to be lots of beds, um, and just curtains covering them so you can hear everything outside and everything around you. If they have a feeling that they're going to keep you, um, like if they know that right away, they're
Mhm.
more likely to put you in a bed with a door. Um, so you're not in the craziness the whole time. I think the last time I was in the ER, which luckily, knock on wood, was a while ago. Um, I ended up I was at a different one than I normally would go to. And while I was waiting, there was like once I finally got in, I'm like, oh yes, a bed. And there was a bed. And there were like 15 different curtained rooms that were all around me. So that was pretty brutal. And I can't imagine dealing with that after a major surgery.
So in regards to my stay where I was the only one without a door, I thought that maybe they had no other option but to give me the handicap accessible one. But then I was like, why would they do that to handicapped people? Like, excuse me, handicapped people. Like, they still need to sleep, you know?
Yeah.
Like, why would you make a room without a door?
Yeah,
Um,
that doesn't make sense to me.
anyway, okay. So Canada implemented universal healthcare in 1966. We have not done so, despite the fact that Yale did a study in the year 2020, which showed that Medicare for all, aka universal healthcare, would save around 68,000 lives a year and would save the US 13% of the budget, aka $450 billion a year. And according to the CDC, 129 million people in the US have at least one major chronic disease. So I would like to point out that Obamacare, now called the Affordable Care Act for some reason, has made it so that you are not immediately denied by insurance companies, which was very popular pre-Obamacare. Um, and it's just, we would save $450 billion a year.
Wow.
It's just, I don't understand why we have not implemented it, considering that I know there's fear that taxes would be increased, but having lived in two different states, I know the difference between my two experiences, but I would like to know like how you think that your experience would differ between if you lived here versus like where you currently are in Canada.
So, a couple years ago, I was diagnosed with ovarian and uterine cancer. I like to joke that I got two for the price of one because they found one and then they found the other,
Mhm.
uh, which honestly, it was fantastic in the way that it was both were caught at stage one. So that saved a lot of scary, but I had two surgeries. So I had my ovary removed, which had like a gigantic tumor on it. They originally said it was a cyst. It was not.
I was just
Uh,
about to ask that. Yeah.
yeah. They're like, maybe not. Um, and after the surgery, all went well, but I think I stayed in the hospital for about 5 days just to get me back on my feet. And I had like in that time I had an epidural to kind of like numb the area. And after the surgery, after they took the stitches out or the staples out, um, I had something called a dehisce, which is basically when the scar tissue opens, and super gross. Uh, but I ended up going to the ER, and normally wait times are high. I went in and they were saying, okay, it's going to be like 8 hours before anyone sees anyone. And I got myself comfortable, or as comfortable you can be as you can be when your body is open.
Mhm.
Uh, and I was called back to triage about a half hour later, and they immediately put me in the back and checked things and did some manipulating of things, added some cleaning, all of that stuff, and wrapped me back up. And then I stayed overnight until a specialist nurse could help. And I was referred to community care to get a vacuum, which would help close the wound easier. All of that I paid nothing for. I received great care. Um, at the beginning, when they weren't sure what it was, um, my appointment with, oh my goodness, need a doctor in here now. My appointment with the obstetrician gynecologist was set for about a month later.
Mhm.
And I went to my family doctor and he was like, nope. He looked at the CT scan. The day I was at the hospital, I got a CT scan
Mhm.
and a ultrasound. And then a week later, I got an MRI and I had my appointment with the surgeon. So uh, again, all of that happened really quick, which is great. But then I was told by the surgeon who originally looked at me that because my CA-125, which is a cancer antigen for ovarian and uterine cancer, was so high, and we're talking like 1400 when it's supposed to be 30. So like, yeah, it was definitely cancer.
Mhm.
Um, but they said, we're going to send you to a cancer specialist just in case. And that was about a month later. I think like mid-August.
Mhm.
Um, and I was so angry because the surgeon was supposed to do my surgery mid-August.
Mhm.
So I was like, why am I having to wait for this? But I'm very glad I did because she wasn't prepared to do a surgery where it was cancer. But she knew that there are specialists that are ready for it, and that are exceptional at their jobs. Not saying she wasn't, but um,
Mhm.
and so like they could literally biopsy while they were in there doing the surgery. So the by the time I got my surgery, it was late September. So again, another month. But they weren't sure what it is. Um, yeah, so they were able to take a look at it in the OR so
Mhm.
that they could give me and my family an idea. Oops, it's cancer. Or it's most likely cancer, because they never give a definitive without doing the additional pathology report.
Mhm.
Um, but yeah, so 6 weeks later, I got that report and I was diagnosed with stage 1C because apparently it had exploded while they were inside. But luckily, they were able to get everything out. So all of the dangerous stuff they were able to deal with. So she said, there are lots of options for you, but why don't you try to preserve your fertility first?
Mhm.
Uh, because I had mentioned that that's something that was important for me.
Mhm.
Um, And the likelihood, I mean, what was expected was that they would do like 5 years worth of shots, so once a month shots to shut down the estrogen production because my cancer was estrogen receptive. Um, and then I went to the fertility specialist and we talked periods, and they were like, and decided to do a biopsy. Um, which, by the way, should be medicated. It should not be done without a little bit of happy juice at least, because it is awful. Um, and a week later, I got those results, and it was like, all right, we're gonna have to push forward. So I started IVF like near the end of October.
Mm.
I still had the vacuum. I was looking really great, and did the stabbies. Now, IVF, um, part of it was covered because it was through the cancer program. So I had to go to a specific place, and some of my most of my testing was included, and some of the other things were included, um, as well as the first year of what I like to call childcare, aka egg freezing. So I did have to pay for some of the testing because I was insured. Like I said, I have insurance through my job. I was able to get some of it or the majority of it covered, where it might not be available to everyone. And then I had my hysterectomy in December. That was a day surgery, which kind of shocks me. It was, now it was a laparoscopic surgery, which means that the scars were minimal.
Mhm.
So I like to joke that they're like my bullet holes, as opposed to the big gigantic one down the middle. And it's interesting because when you have a surgery like that and you're sent home the same day, you don't really think of it as that big of a deal. Um, but it kind of is. Like they removed two major organs from my body. It was not actually, no, I wanted to say it was not actually that bad of a surgery. That's a lie. It was a hard surgery. I think any surgery is a hard surgery. Um, but I felt really well taken care of by all of the doctors and nurses. My oncologist has a very trauma-informed approach. So she gets down to your level, talks you through it. There were a lot of organizations that helped within the hospital system. So social workers and um, like other resources. There were times at the beginning where I felt alone, but once I got to know more about, how many people are out there living my same situation, um, there's a sense of connectedness. And I know that there are great charities in the United States. And I know I've even like been in contact with some of them, chatted with some of them. And I know that cancer patients a lot of the time do get great care in the United States. And being where I am and having the kind of financial background that I've had, I I might be alive, but I would definitely be in debt, like significant debt. Uh, so
If
yeah,
you were here.
if I was in the United States, yeah. Um, so it's a tough situation.
That makes me think. I actually do have a friend who has recently gone through um cancer coming back, and then he was turned down in regards to getting help from Social Security as well as disability,
Wow.
and is currently having to work despite have going through, having to get treatments. And I was wondering, if you were in that situation, would Canada have some sort of support system?
Yeah, so if you've been working continuously, we all pay into EI, employment insurance. Um, and you're entitled to short-term disability if you're having like short-term issues. I think it's up to 20 weeks, but yeah, we're entitled to that. And then long-term disability um, is anything that's past that time. It's for anyone who has exceeded the benefits given to them by employment insurance. That's hard. I can't imagine having to go back to work when you find out you've got a new kind of cancer or that your cancer's returned. I mean, that's a psychological blow as well as a physical one. So, I was on short-term disability for about 3.5 months and then did a slow return to work. So I did about 3 months of a slow return. So I was lucky in that sense. Although I did have some medical professionals say, well, it's not our job to keep you off of work. I'm like, yeah, but like, I just got rid of the cancer. So I'm kind of dealing with a lot. And I mean, I'm sure some people understand, some people don't.
Mhm.
It takes a huge mental toll on you. It's a physical toll, which I'm starting to realize now. But also it's a mental toll.
Okay. Well, thank you so much for all your info, Caitlin. Shout out to the newfies, because my grandpa was one.
Thanks
Hey,
for having me.
appreciate everything, and I wish y'all the best.